let me talk to you about the 9 seconds that could save your life. Cardiac coronary calcium CT scoring is a specific test that we use as a screening examination. Now, if you have a negative cardiac CT, then the chance of heart attack is almost zero. As we know, in the Middle East, in Southeast Asia, and in the developing world, the number one cause of death is cardiac disease, and specifically acute MI. Now, acute MI means acute myocardial infarction. So what does that mean? That means that there are certain places in the heart where the vessels go, specifically the arteries. Now, these arteries can become blocked. When they become blocked, we have what's called a heart attack, or as we call it, a cardiac myocardial infarction. So an acute myocardial infarction is when the arteries, which come from the aorta, the left coronary artery and the right coronary artery, can become blocked. And what happens is when that blockage stops the blood from traveling through the artery, that heart muscle will die, or what we call myocardial infarction. Infarction means death of the heart muscle. And when the cardiac muscle dies, then the heart cannot beat properly. And when it does not beat properly, then it stops providing blood to the brain and to the rest of the body. And when that happens, patients will die. Now, let me talk to you about the 9 seconds that could save your life. Cardiac coronary calcium CT scoring is a specific test that we use as a screening examination. Now, if you have a negative cardiac CT, then the chance of heart attack is almost zero, depending on your risk factors. So, risk factors include family risk of heart disease, your cholesterol levels, if you smoke, if you're overweight, and sedentary versus active lifestyle. These risk factors are very important in determining what we call cardiac risk. Next very important factor is your coronary calcium score. Your coronary calcium score is the amount of calcium that's deposited in the coronary arteries. And this happens when you start to develop atherosclerotic plaques in the arteries. Now, what's very important for people to understand is that the very first symptom of greater than 50% of people who have cardiac disease is a heart attack. So 50% of people will have no symptoms until that point. They will have no episodes of chest pain. They will have no episodes, loss of breath. They will have no episodes of severe sweating. They will not have any of these symptoms. And this can be a deadly MI. How do you protect yourself against that unfortunate circumstance? Well, the first thing is you get your cardiac CT scoring and screening done. That 9-second test can show immediately if you have a score below 100, the chance of you having a future cardiac event is almost less than 1%. However, now, if you have a score above 100, at that point you need to see one of our cardiologists and we will decide which further testing you need. This test needs to be done for the majority of people. The other thing about cardiac CT is also helps with calcium scoring. It shows atherosclerotic plaque, and there is also a direct risk to your risk of stroke. Now, stroke is the second biggest killer of people in the Middle East and Southeast Asia, and also the Western world. So, if you have a negative cardiac CT, your chance of cardiac heart attack is almost zero, and your chance of stroke is also almost zero. So I recommend anybody watching this video, as I told you, these 9 seconds will save your life. Get your cardiac CT scoring screening exam done today.